Hello and welcome to Pathology in a Nutshell. I am Dr. Nazish, and today we're going to discuss a very important pathological aspect of chronic inflammation known as granuloma. Granuloma morphology is very important and it's being very frequently asked in exam. So we will discuss the gross and microscopic features of granuloma. First, we should know what is a granuloma because it is actually an inflammatory process and a reaction of immune system to confine the injurious stimuli to a particular site. For example, granulomas are very common in the lung. So what they do, they actually confine the injurious stimuli, whether it be a bacteria or any other inciting agent or a foreign body material. On gross morphology, this is a specimen of a lung, and you see a very specific grayish-white area within the lower lobe, and it shows that the morphology of this particular area is very different than the rest of the rest of the lung. So this is very easy to identify actually on the gross morphology. Sometimes on gross morphology, it gives you very confined area. It shows a very confined area which is grayish white, and maybe when you give it a cut, it becomes a very you will feel it to be a very rubbery and cheesy sort of a material because it is forming gradually. It forms caseation type of necrosis. Talking about the microscopic aspect of granuloma, when we go on low magnification of a tissue slide of lung parenchyma, this is the whitish background is lung parenchyma with all the air spaces. But in air spaces, you don't normally expect solidified areas. Here you can see solidified areas and a very well circumscribed areas also. So 1, 2, 3, 4, 5, 6 here maybe. So when you go for a closer look, you can also see certain giant cells present over here. Another giant cell. Another giant cell. So when you go for a closer look at higher magnification, a granuloma may appear like this. It is a confined area, first of all. It is bounded by fibroblastic rim and a rim of lymphocyte surrounding the whole area. When you go closer and in the center, if it is caused by a tuberculosis, Mycobacterium tuberculosis, then you can see that it is having a central necrotic area, which we call it caseation necrosis, and this pinkish area is slightly more deeper pink than the surrounding areas. Also, you see 1, 2, 3, 4, maybe there's 7, 8 giant cells over here. Now, what are these giant cells? These are actually the merger of macrophages. Now, these macrophages are actually merged together and they form a giant cell in which there is peripheral arrangement of nuclei, and this is why they are typically known as Langhans type of giant cells. Another very important feature of a tuberculous granuloma. For another tuberculous granuloma, I can show you this slide, which is maybe this is going to give you a different aspect or view. In this is again another type of granuloma which has caseation necrosis in the center, some dash of these purple dots which are elongated cells. These elongated cells are nothing but epithelioid cells which are modified macrophages. Another closer look at caseation necrosis with these, maybe this is forming here, this is forming a giant cell, but these elongated cells are actually the epithelioid cells. They have a nuclei with tapering ends and indistinct cell boundaries. Here another, in this situation you can see a very well marked central portion which is more pinkish as compared to the surrounding area, and this is known as caseation necrosis. When you give it a whole view, you can also see some lymphocytes residing outside the boundary or making the boundary of this granuloma. Now, if we're talking about tuberculous granuloma, then we also need to identify that there are certain type of granuloma which give you a typical picture. A typical picture in the sense that they give you a confined, well circumscribed area with lots of, these epithelioid cells, these elongated ones, right? This elongated one is another epithelioid cell, but you don't find any caseation necrosis in the center. Another very important feature to identify as granuloma is a giant cell. In this case, this is a Langerhans type of giant cell because the nuclei are arranged peripherally. When you go for the whole view, you will see lots of lymphocytes rimming these areas, these granulomatous areas. Talking about the organism causing the, this organism which is causing this granulomatous inflammation very commonly is Mycobacterium tuberculosis. And you can see that this is an acid-fast stain, and on acid-fast stain you see this pinkish rod-like structures which are nothing but Mycobacterium tuberculosis, confirming our diagnosis of a tuberculous granuloma. Besides tuberculous granuloma, another very important type, or very common type of granuloma is found, which is it's foreign body granuloma. Now you will wonder, where is granuloma? This is not a granuloma. It may be fibrocollagenous material, but it is not a granuloma. Now where is granuloma forming? Actually, the granuloma is forming against this foreign material. In this case, it is the suture material which is being left behind in the tissue, and against the suture material you will see that a giant cell is forming. One giant cell, or maybe you see another giant cell. Now this giant cell does not have a peripherally arranged nuclei. These are haphazard arranged nuclei. So this is one of the very important identification point for foreign body type of giant cells. Okay, so basically this is going to be a granuloma with a foreign body material and giant cells. Now another example of foreign body type of material is a plant material, against which this you can see this giant cell forming here, right? But you can appreciate that these are haphazard arranged nuclei. You don't find too many epithelioid cells over here, but you see a lot of these dot-like structure which has lymphocytes, and this against this plant material. So this is a foreign body type of granuloma. I hope this make you a clear understanding of a granuloma, and in your exam you will find it easy now to pick up a granuloma. Thank you for watching.